Spend a 24-hour OB call shift with me.
Everybody's up early. We're all jet lagged and recovering from Thailand. We are constantly wide awake at 4 a.m. Boys are gonna walk in. Because our labor and delivery unit is so big, we staff it with 2 CRNAs, a resident, and 2 attendings at all times. And in fact, during the daytime, during the week, there's actually a 3rd CRNA on and a 2nd resident. It is extremely busy. They always put the small scrubs on top for the short people. Emergency medications in case we have to do a crash C-section for a patient that already has an epidural in place. This is lidocaine with epinephrine, a little bit of sodium bicarbonate, which helps increase the onset of action. We are going to replace an epidural for a patient who stopped working overnight. She's comfortable and sleeping. We're gonna go remove another epidural. Next epidural request coming right up. Just placed another epidural, gave some tranexamic acid to a patient who is having a bleed after delivery, and now we're getting ready to set up for a C-section. It is 10:45 a.m. Grab some aromatherapy patches before we go back. These can help decrease both anxiety and nausea. And I'm also gonna grab some ice packs. It's one of the many tests we do after placing a spinal to make sure that the patient's totally numb before the C-section starts. Getting a little call room nap in. Finish an emergency DNC for a patient who is bleeding after their procedure. Time for another epidural. Just had an emergency C-section and then 4 epidural requests at the same time. Thankfully, there are a ton of us around. I'm about to look up this patient and go run in there so we can get everybody squared away and comfortable. Just rushed another patient back to the OR for a potential emergency C-section. Dodged the bullet. No section necessary, but I did just get another epidural request. I'm going to attempt to take a nap in the car again. Let's see how it goes. Got a 3-hour nap. Placed an epidural that stopped working. Gave a couple extra doses to patients who were having some pain as their labor was progressing. It is 7:30. Gave handoff to my friends, and now I'm going home.